Access to health care even more difficult for some families during the pandemic. Channel 5's Monica de Anda tells us what one healthcare company is doing to bridge the gap.
Skylight Health is bringing its services to the Rio Grande Valley with the goal of making sure everyone has access to medical providers, whether you have insurance or not.
According to the most recent data from the U.S. Census Bureau, in 2018, 17.7% of Texas residents, about 5 million people, had no health coverage. This percentage up from 17.3% in 2017 and 16.6% in 2016.
We do believe healthcare is a right. It should be accessible. It should be affordable. And it shouldn't be a challenge.
Brad Saker, the CEO of Skylight Health, says the number of uninsured people could keep growing thanks to the pandemic.
If the patient gets up, they don't feel well, they have a cold, especially now because of COVID, you don't necessarily know, is this something I should get checked? What exactly is this? And if you don't have healthcare insurance, where do you go to get checked today?
That's where he says Skylight Health could help. Through a national network of healthcare centers, they provide healthcare services for everyone, whether you have insurance or not. And if you are uninsured, services for mental health, cold or flu-like symptoms, chronic conditions like diabetes, and more are all available for 54 cents a day, less than $200 a year.
It doesn't matter if you call once, if you call 10 times, if you call 20 times in the year, there is no additional fee. There's no copays. There's nothing else.
Contact with medical professionals would be through telehealth, a platform that Saker says medical professionals have leaned on more than ever since the pandemic began.
Telehealth has its place when it comes to creating access for patients, especially those in rural communities that don't have the types of specialists and providers who can easily see them. And especially when we see patients today in Rio Grande, where sometimes a consult can take upwards of months, and even then it's usually pretty difficult to get in to see a specialist who may not be in town directly.
All with the hope of making quality health care more accessible to everyone.
For more information about this subscription-based healthcare option, head to their website, skylight.health. Monica de Anda, Channel 5 News at 6.
Could be some